Welcome and thank you for attending this Lunch and Learn session organised in collaboration between the Knowledge and Library Services at NCIC and CLIC, the Cumbria Learning and Improvement Collaborative. My name is Ashley Eaton and I am from CLIC, and today we are joined by Hannah Reeson, also known as Hannah Hinckley, who is the District Nurse Team Lead for the Keswick and Solway ICC. So these Lunch and Learn sessions are designed to be a relaxed and informal space for health and social care staff to come together and share experiences. And I will now pass over to Hannah.
Hi everyone. So like Ashley says, I am Hannah. I'm a District Nurse Team Lead over in Keswick and Solway. And what I'm going to be talking about today is leading others through change through an organisational change that has happened particularly in community within NCIC. So what I'll be talking about is what is the change that we've gone through, what we did as an organisation, who was involved, what was the outcome, and how are we sustaining it. And within that, what I'll be talking about is some change models that are out there and some theories, but then also my experiences and what, as a leader, I would particularly like my methods I would use with leading people through change. So to start with, within the organisation, the change that we had was implementing eCommunity. So eCommunity is an employee rostering and workforce planning tool, and that's for community healthcare providers. So and this was rolled out within all of the 8 ICCs across the community, and Keswick and Solway in particular was the first early adopter for this, and that's the area that I work in as well. So what we did and who was involved. So at the start of it, what we wanted to do was create that open and honest, transparent culture, and that was really, really important to do that. And I think what I found of experience with leading people through change is you need to take it right back to basics before you even start thinking of the change that you're going to be implementing. And that right back to basics is looking at your psychological safety within your team, making sure your team is, you've got good teamwork. When we started the project, we implemented a project group. And within that project group, it consisted of our Associate Director of Nursing, we had a quality matron, our e-roster team, senior clinicians and some ICC managers. Being part of that project team myself as a senior clinician was really helpful and was really effective as part of that early adopter site, because it made us experts within the field of e-community. So then when we were driving that change with everyone else, we really knew the system really well, and we were able to really support everybody through it and be able to problem solve with anything we had. So having that as part of that and being experts in what you're going to do with your change was really, really valuable. So what we've done to start with was looked at the project team. We looked at how us as leaders, how we manage our own resilience with change, how our own emotional intelligence is, how our teamwork was within a project team. And we also looked at true colours and personality tests to understand each other's personalities and how we would work together. And I think that was really important to start with, to look at the project team first, because we needed to see how we would manage with change before we started implementing it to everyone else, and how we'd support everybody else through that change. And looking at different leadership styles as well, of what leadership styles we were going to use with implementing this change. Looking at that adaptive, authentic leadership of change, and it depends on who you're talking to, because with this change we were looking at very different staff groups, very different clinicians, so it was adapting that leadership depending on who you were talking to. And my personal preference with that leadership is that compassionate leadership by Michael West. It's really important that we're compassionate with staff, and we're very approachable. So I find with teamwork is you've got to build those foundations, you've got to build that basic level of teamwork. And what I look at a lot is that psychological safety. So if you've got that psychological safety within your team, being able to implement change, it makes such a difference. So giving people the ability to be able to challenge that status quo, to be able to speak up if they needed to be able to express their ideas, and for them to be able to feel safe and be able to know that their ideas are listened to, and if there is any problems there, then they know they can discuss those problems. And I think I very much push that no matter where you are in the team, no matter what banding you are, no matter what level you are, is being able that ability to be able to challenge that. So someone be able to challenge me with what I'm saying and vice versa. And that's really important with change. And I think especially with that at the start of that change cycle is when you're communicating what it is that ability to be able to have that two-way conversation, and that psychological safety really helps with that. So what we done at the start of implementing the change-free community, there was a timed process of how we implemented it across the all 8 ICCs. And as the early adopter site, our go live date was August of 2021. And what we done was we started doing Microsoft Teams calls 6 months before it was implemented. And that was within those Microsoft Teams calls, it was for drop-in sessions for anyone to join, to watch a demonstration of this new system that's coming in. This is the benefits that it'll have to patients, to staff. And this is what it'll be. So we had those on a regular basis every single month for people to drop in. We also had 2 days training for every member of staff that was going to be in the system. And then when we went live in August, we had daily drop-in sessions again on Microsoft Teams. We had drop-in sessions face-to-face to people to come in and problem solve with any issues when they were using the system, and just to create that safe space of being able to ask any questions. When we went live in August, we also had a lot of communication with all the other ICCs around the progress of that early adopter site, and also that progress with the project team. So there has been bumps in the road with the new system, like there is with anything else, and we've communicated what those bumps in the roads have been, the problems we've put in, the problem solving that we've done, and what the project team's responsibilities and the roles are. So when we were building the system, as well as the project team, we had access to test sites as well. So we had everyone that was from the early adopter site having a play around on the test sites and having them, understand the system before they went live. And that really helped with people's confidence of knowing how to use it before it was live. Another aspect of that, bringing it back to basics, is understanding everyone's professional identities. So professional identities is how professionals define themselves within their work role, what the cultures are like within the work, ensuring everyone's valued in their contribution. And I think with eCommunity, it was an area that it's live across a lot of areas within the UK, but we were actually the first area to be going live with community rehab teams and home care practitioners. So we had the potential at the start of the project of people having that there was a fear of losing their professional identity as it was changing some staff groups about the way they worked, and it was slightly differently the way they worked. And how we overcome this was by regular communication, but also by that narrative of storytelling. So I think when you're proposing a change to people, bringing that emotion to it is really effective with change management, as it requires that personal connection as to what would that mean to me, what would that mean to my patients. And using that strategic narrative of storytelling, it's that form of communication where the leader has a clear vision about what that change is and what the future will look like for them and what the future would look like for the patient. And it's effective to do that with staff to ensure that it resonates with them emotionally, and it made a big impact. So then when we come up with some barriers when we were implementing it, and we would have some people not feeling connected to it, we implemented super users within the eCommunity, so they were able to positively feedback where it's worked well, or when they have come up with problems, how they've resolved it or how they've overcome those problems, and what impact it's had on staff and patients within the system, really. So what was the outcome with us changing, implementing this system? So right now, all of our 8 ICCs are live with eCommunity. We have got a couple of areas that are still working through a couple of a couple of problems with it and overcoming some issues, but we have actions and outcomes in place that are allowing us to work through this system. And already now we've seen the impact that this system has on our on all 8 ICCs. Now what we are looking at is looking at the data that it's telling us. What impact has this system had on the way we work? And it will, so far it is making an impact on the future and how we manage our capacity, how we manage our patient care and the well-being of staff as well. So the system that we used before didn't have we didn't have any capacity to be able to see what was going on day to day, and this is able to do this now. So it's made a huge difference with how we manage day to day on a basis. So the project team continue to meet regularly and senior clinicians are involved with that as well. And we are also working with the company themselves to develop the e-community itself. So what we are doing is as a organisation, we have seen that there's part of this system that could be better. That we've seen parts of the system that works really, really well. And I think with this change, what has worked well is we have worked with Allocate on a daily basis to give them ideas of what could be better from a clinician's perspective, and that's been really good. So just quickly touching on change models and theories. I personally, have looked into a lot of change models with implementing change in the past, and I've just always used them as a guide. And I've used Cotter's 8-step process there, and it helps you as a leader guide you into knowing what steps to take when implementing that change, whether it's helping people understand the need for that change, making sure that there's a need for us to be able to do this all together, how the future will be different to the past and communicating that to everyone and what impact this change would have, removing any barriers that are there and articulating that connection between new behaviours and that organisational success. But the big one I always find really helps with that change is that the Kubler-Ross change curve. So this is recognising that any change comes with emotion, and resistance to change is completely normal. So, and as a leader, leading through that change process is continuously checking in, recognising where people are on that emotional roller coaster that's going to happen, and understanding that people can fluctuate on that curve, that you yourself as leading through that change will be on that curve yourself, and just providing that right support for that person, for the team, for the organisation to be able to get through that curve. And some people will be able to recognise that change curve model and that emotions is very similar to the grief model as well. So it's just understanding that change, can be a bit of grief as well, of grief of, the old system that you used to use, and it's just really recognising and understanding and being there for people that, that they're going to be going through those emotions. And change can be really challenging, but if it's done effectively, it can be really, really rewarding. And with change models and theories, there is so many out there, and not one model fits all. So you wouldn't be able to use one model for every single change that you're going to be implementing. It's having an understanding of there is lots out there, and depending on your change, depending on the situation, depending on the team, depends on which model you'll be looking at as a guide and as a bit of a help for you as that leader. So how are we going to sustain this change that's happening? So the biggest thing that I find with change and how we're sustaining it is that motivation around it. With any change, you need any baseline that's happened previously. So what we look at within community services is all of our data. So like I said before, now with this new system, we'll be looking at what impact it's had with that data. And with that, it's sharing that. So sharing the impact, what this system has had on patient care, on staff wellbeing, on the way we work, what difference has it made? And the way that we motivate, so when you're making change, people look to leaders. So they look to you to role model. So in times of change or uncertainty, they'll look towards that leadership team for direction. So the way we sustain it is role modelling the right behaviours for that change. And that's how you would sustain it. So it's maintaining that motivation with the positivity around what's worked well, what hasn't worked well, and discussing those successes that's happened. So if there's any other questions you'd like to ask me around, obviously it was only 15 minutes, so it's very short and sweet. I could have talked about this for a very long time. So if there's any questions, I welcome them.
Brilliant. Thanks, Hannah. Yeah, please feel free to post any questions in the chat, and I'll keep an eye on it. And yeah, brilliant. So Hannah, I've got a question.
Yeah.
So you spoke about the challenge around kind of that professional identity and that kind of sense of connection. Were there any other challenges along the way?
I think there's been a few challenges with the system itself. Of the way, the way that it's worked, and like I said, there's been bumps in the road of that. And I think from reflection of how we have managed that as the project team, sometimes we found that reluctance to the change has been because that communication maybe hasn't been right. And that if we just this is the problem, this is what we are doing about it, we are working with Allocate, we are putting things in place, I think that would have made more of a difference with that reluctance. So I think it's just that communication of how, if you're coming up with bumps in the road, how you're dealing with it, and being open and honest and very transparent about it. And as we've went through the project, we've definitely seen that there's areas that we could have done better, there's areas that we've done really well. But I think it's the biggest thing is communication.
Well, thanks, Hannah. We've got a couple of questions. So Anne's asked, can Hannah give us a little example of storytelling?
So the storytelling, there's an example of that with eCommunity, especially from an early adopter site of how as community rehab team have used the system. So like I was saying, with that professional identity, the rehab team have changed slightly the way they work because of this system. So the rehab team would always manage themselves with a diary of how their patients that they're seeing, and put it on this system. Now some people started to feel like it was going to be a bit of a big brother moment of, I'm watching you. So seeing other rehab teams, we had lots of MS team calls of that storytelling of a rehab member of staff coming on and telling a story of a patient, of when they put it onto eCommunity, they discussed what with the patient that they had scheduled their treatment, and they'd put their next date of their treatment on, and the impact that had coming back as well. So I would join those calls and discuss from a nursing perspective. I wouldn't have been able to see a rehab's diary before now. So it's allowed us to be able to work better closely. So as a lead professional, I am booking in lots of discharge to assesses for rehab teams. And before this system, I wouldn't have known when I've been able to book that in. So just communicating that with them and telling them that story to make it real, it makes it a lot easier for people to understand what difference that system would make for people, because instead of just saying, this is what it is, it's them making it real by telling that story.
Brilliant, thanks, Hannah. And another question from Sheila: how did you deal with any resistance to the change?
The resistance to the change, it would be, again, like I've said, that communication of those. If it was individual resistance to change, those discussions of understanding that resistance. So what's causing that resistance? What's their emotion behind it? What's their feeling behind it? Is what's stopping them want to be able to understand the change really, and come with everybody else along the change. So it's understanding it really, and understanding why it's resistant for that individual, and being able to put plans in place, any support in place. A lot of the times we found that resistance was their understanding around the system and their frustrations with maybe technology. So it was then putting things in place of getting everyone a smartphone to help with the system, because it's a lot easier to use when you've got a smartphone. So it's and then just communicating. This is the barrier we've had, but then this is what we've put in place to be able to help with that.
Brilliant. Thanks, Hannah. I've just got one more question myself. So what's been like the initial results of this new system? Have you seen anything already?
Yes, so we're starting to pull off a lot of reports now, and the biggest thing is that we are able to really now showcase the lack of resource that we have, and whereas on the system before we wouldn't have been able to showcase that on the system, whereas this is really highlighting our capacity and demand, and that's the biggest thing that we're taking from this is that it's really showcasing, and we're able to evidence that capacity and demand.
Yeah, and I suppose then also hopefully be able to then kind of recruit within those roles, whatever is required.
Yeah,
Brilliant.
Hopefully.
Got a couple of comments as well now, Hannah, popping in. Sheila's shared a great example of managing change. I liked the practical use of models too. Well done. And Jane has shared your compassion and leadership shines through, Hannah. So some lovely comments for you there. Okay, guys, if there's no more questions, we will start to wrap up. So thank you all for attending. Again, just a reminder that there is a link to the feedback in the chat. So it'd be great to find out what you thought of today's session, and if you've got any ideas for any future ones, that would be great. Thank you ever so much for attending.
Thank you.